Hello everyone, welcome to another one of Elite's patient information videos. Today we're going to be talking very briefly about a treatment called Aqualyx that you may have seen is available in a lot of aesthetics clinics. So what is Aqualyx? Aqualyx is a medication, it's a prescription medication that involves an active substance called deoxycholic acid. So we use deoxycholic acid to break down and to emulsify fat. It is used in areas of the body where you find localized adiposity or localized areas of fat that are very hard to break down and get rid of with traditional diet and exercise. So starting from the top down, we're going to talk about some of the areas that you can use to treat with Aqualyx. And by far the most popular area that we find treatment, that patients require treatment for, is actually the submental area, or this sort of fat pad underneath the chin. Now, it's an accumulation of fat that we find there that usually gives a bit of a rounded appearance, which is really not desirable for patients. And Aqualyx is a medication that can be safely injected into the area to help to break down the fat. Other areas of the body that we find patients request are actually kind of the areas around the upper chest, especially in men, when you find that men have put on a little bit of weight and they tend to get a little bit of flabby fat around the chest. It can be used in the upper thoracic region as well. Can be used for the muffin top and can be used in the entire area around the abdomen and hips. We always advocate that patients diet and exercise, and when we say diet, we don't necessarily mean anything too drastic, but something that is natural, healthy and sustainable. And we find that with those patients, they find it quite difficult to shift some of the hardened pockets of fat around this region, where it can actually be quite beneficial to have Aqualyx injections. The other area that is quite prominent, where we find that patients are requesting information, is the inner and the outer thigh, and perhaps in some of the areas around the knees as well. What is important is that when deoxycholic acid is injected, it is injected into the soft tissue. So the doctor who's performing the treatment has to be quite skilled in knowing exactly what depth the fat pad is to be found at. And in certain individuals, males versus females, certain race groups, you find that the dermal layer is significantly thicker, so an examination of the area is quite important. One of the nice advantages of Aqualyx is that it can be mixed with a little bit of local anesthetic, so it gives a bit of relief. Further to that, how does deoxycholic acid or Aqualyx actually work once it is injected? Once it's injected, it breaks down the cell walls of the fat cells. So if you look at what a fat cell is, it's kind of a rounded cell that is very kind of easily malleable. So it has a cell wall which is generally quite thick, and the contents on the inside of the cells, usually the lipid component or the fat component itself, is liquid. So what you need to do in order to break that open is you need to work on the cell wall, and that is what deoxycholic acid does by a process of saponification. So it will break that cell wall, and all of that contents will then kind of sit in that tissue layer. So what's the next step? How do we get rid of it? So great, we've broken down the cell wall, we've got that lipid content that's now sitting in the tissues, we need to get rid of it. And the way that fat gets transported away from the site, metabolized, that is broken down, and excreted, that means out of the body, is done in a three-step fashion. The first step is actually the inflammatory process. So by virtue of the injection and by virtue of injecting deoxycholic acid into the skin or into the hypodermis or into the fat layer, what you find is quite significant swelling and inflammation. With the swelling and inflammation, we rely on that process to actually activate the lymphatic system, which will then transport the fat away. Fat is then transported, fat or lipid as such, is then transported to the liver, where it's packaged and it's excreted into the urinary system. So when you have your consultation, we will discuss things like, what is your current weight situation? What is your exercise level? I find it a little bit unethical to be treating patients who are not actively exercising. The reason for it is that Aqualyx is not a quick fix. It's there to help localized adipose tissue or localized fat pockets and to help to break them down. There is a maximum limit or maximum dosage as how much we could do within a particular session, and that's usually restricted to the number of vials that we are allowed to use per appointment. So how many treatments are required? For some patients, if the fat pockets are quite small, 1 treatment is sufficient. However, broadly, it's somewhere between 1 to 5 treatments done 2 to 4 weeks apart, depending on the swelling and the inflammation and the inflammatory response, which is individual to each and every patient. I would also like to mention that there are compression garments that can be used, particularly if you've seen, if you've Googled any of this, or if you've had a look on the internet, you find that there's kind of like a face sling that can help with the inflammatory process by way of external pressure. So it allows more pressure to be put into the lymphatic system and for easier drainage of the broken down fat cells, again, to be transported and packaged in the liver through to the kidneys and excreted out of the body. So who can't have Aqualyx? There are certain people who with certain medical conditions who are not suitable to have Aqualyx, and most commonly are people who have known allergy to deoxycholic acid or any of its derivatives, and also patients who are pregnant or breastfeeding. The reason is the product's never been tested on those patients, and therefore it is an absolute contraindication as such. What results can be expected? Most patients are quite happy with the results, and what I find clinically is the thing that freaks patients out, or the things that makes patients panic, is after the injections is really the amount of swelling. So what is really, really important is to understand what the process will be that will happen, and this is followed through in a very, very detailed consultation with yourself. If there are patients who are perhaps client-facing, or patients who cannot have time off work, or patients who, in the current situation, who have to appear on Zoom, and, the swelling will most likely be quite noticeable, it's better off that they have it perhaps on their holiday time or at a time that is more suitable for them. Is it safe? Yes, it is safe. The injection technique is what is quite important. The dosage is what is important, and the expectation. So it's not simply a matter of injecting a whole lot, as much as possible, into the area to get the best result. Remember, when Aqualyx is injected, you then have an inflammatory response, and that is what is variable. Some people are just not swellers, and some people are massive swellers. They could just kind of bump their arm or their leg up against a door, and you find that they swell up and they bruise very, very easily. So that is something that we have to take into account when doing these injections. And then, of course, you are then followed up. The results are compared. If it is an area that can be measured, it will be measured. And then we will follow on from there based on the clinical response. If there are any other questions that you may have about Aqualyx,